Panic disorder and agoraphobia. Panic disorder is diagnosed in people who experience spontaneous, seemingly out-of-the-blue panic attacks and are preoccupied with the fear of a reoccurring attack. Panic attacks occur unexpectedly, sometimes even during sleep, also known as an anxiety attack. Around 2 million British adults experience panic disorder in any given year. Typically developing it in early adulthood, women are twice as likely as men to have panic disorder. This may be because men are less likely to report it. Many people don't know that their disorder is real and highly responsive to treatment. Some are afraid or embarrassed to tell anyone, including their doctors and loved ones, about what they experience for fear of being considered a hypochondriac. Instead, they suffer in silence, distancing themselves from friends, family, and others who could be helpful or supportive. Where does panic disorder come from? What many people don't realise is that the fears panic disorder is built upon at any one point in our history were adaptive. Fear of an open space, you would have been in view of predators, or being scared of heights, the only exposure our ancestors had to this will have been cliff edges, helped avoid genuine dangers and risk. Of course, nowadays, these fears are simply an annoyance, but remember that without them, we wouldn't be here today. Symptoms. A panic attack is the abrupt onset of intense fear or discomfort that reaches a peak within minutes and includes at least 4 of the following symptoms: palpitations, pounding heart or accelerated heart rate, sweating, trembling or shaking, sensations of shortness of breath or smothering, feelings of choking, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded or faint, chills or heat sensations, paresthesia, numbness or tingling sensations, derealization, feelings of unreality or depersonalization, being detached from oneself, fear of losing control or going crazy, and fear of dying. Since many of the symptoms of panic disorder mimic those of heart disease, thyroid problems, breathing disorders, and other illnesses, people with panic disorder often make many visits to the accident emergency rooms or doctor's offices, convinced that they have a life-threatening issue. In the past, it may have taken months, years, and lots of frustration before getting a proper diagnosis. We are hoping to change this by altering people's thoughts on anxiety disorders. Many people suffering from panic attacks don't know that they have a real and highly treatable disorder. The agoraphobia that comes along with the panic disorder relates a fear of a place or situation that will trigger a panic attack. Like other anxiety disorders, panic disorder and agoraphobia can be treated. Most people find significant improvement with professional care. Treatment success varies among people. Some may respond to treatment after a few months, while other people need more than a year. Treatment can be complicated if a person has more than one anxiety disorder or suffers from depression or substance abuse, which is why it must be tailored to the individual. Although treatment is individualized, several standard approaches have proved to be effective. Therapists will use therapy, medication, or a combination of the two, so please come along to one of the workshops to learn more. An exercise to get you started. Do you fear that you are about to have a heart attack when you have no history of such a disease and your doctor has said you are clear of heart issues? Try jogging on the spot the next time you have an attack. You'll see that nothing will happen and the fear was irrational. Consider that you will have had this feeling before and nothing happened as a result then either.